Hello, my name is Fauzan Azimah, and I'm from Class 1A, and I'm gonna talk about PTSD. PTSD is a post traumatic stress disorder that occurs after a person experiences or witnesses a traumatic or very unpleasant event. PTSD is an anxiety disorder that makes sufferers remembers traumatic events. Some traumatic events that can trigger PTSD are war, accidents, natural disaster, and sexual abuse. However, not everyone who remembers a traumatic event has PTSD. There are specific criteria used to determine whether a person has PTSD. PTSD can occur after experiencing or witnessing a frightening or life threatening event. It's not known exactly why these events can cause PTSD in some people. However, it is suspected that the cause is a combination of the following conditions, like unpleasant experiments, family history, mental disorders, temperamental innate personality. Events that are known to most often trigger PTSD include war, accident, natural disaster, bullying, physical abuse, sexual harassment, and certain medical procedure such as surgery, life-threatening illness such as heart attack, PTSD diagnosis. To diagnose a PTSD, the doctor will ask about the patient's symptoms and medical history. After that, the doctor will carry out the physical examination to find out whether the symptoms you are experiencing are caused by a physical illness. If there is no physical illness, the doctor will carry out a mental examination of the patient. PTSD treatment aims to reduce the patient's emotional responses that teach patient how to control themselves when reminded of the traumatic event. Treatment methods that can be done include physical therapy, drugs, PTSD prevention, and PTSD prevention is like PTSD cannot be prevented, but there are several things you can do if you experience a traumatic event. For example, like talk to family and friends or a therapist about the traumatic events you experience. Consult a doctor if you cannot overcome the feelings that arise after experiencing an unpleasant incident. That's all I'm gonna talk. That's all I had to say. That's all. Thank you for listening and goodbye. Assalamualaikum.